Happy Memorial Day weekend here from the Tough Call team. We hope you have a great holiday weekend. Join our conversation on Discord, our fan group on Facebook, or write to us at toughcallmediation@gmail.com. Don't forget to like and subscribe. Enjoy the show.
Tough Call Mediation is brought to you by Herb Legal LLP, serving your mediation and freelance paralegal needs in Ontario, New York, Quebec, and throughout North America. Connect to their website today at www.herblawservices.com.
Hello, and welcome to Tough Call, a mediation podcast. My name is CT Ehler, and I am with my co-host, the Reverend Dale Sheldon. I did it.
Stop doing that. Hello.
He's not a reverend. He's not a real reverend. And we're also with my good former colleague back when I was a healthcare practitioner, but he is still a healthcare practitioner, good friend, Chris Semenuk. How are you today?
I'm doing great. I was wondering if I was going to get a title too, but you know.
Well, I don't know. Are you a reverend?
I could be today.
If you got 5 minutes, you can do it online. That's what I did.
Right? Exactly.
Yeah.
Get certified somewhere.
Yeah. So Chris and I have known each other, Dale, and listeners, just to get you to have a background. We've known each other for quite a long time, but we've never actually met in person.
Correct.
I know,
It's all online interactions through the different Facebook groups and whatnot, right? It's only recently that we've even been like communicating verbally.
Well, even just that we can see each other's face and stuff. Yeah. But we've known each other for years. And one of the things I've always enjoyed about you, Chris, is that a lot of people don't know what goes on behind the scenes of healthcare practitioners. I mean, registered massage therapists are not alone in this attitude. Chiropractors, physiotherapists, doctors, nurses, there's all drama that goes on professionally. And we've had seats at the table.
Grey's Anatomy at the parlor type of thing.
Yes. We've watched it and we joined these collegial forums that were professional groups that have been very beneficial, but also very toxic. It's been quite a range. And one of the reasons that really drew me to Chris is how thoughtful you are, how well researched you are, how you've been fairly even toned, and you've taken the time to unpack things for some of those newbie, those new licensees who come out and they're like, hip. And you've been so kind to be like, yeah, it's okay. Like, don't worry. You'll be good. Just massage. You'll be fine.
Well, thank you for that. Yeah. I try, to be even keeled, tempered, but also like, weird that we're on the show, but getting people to follow their legal obligations and not what they think they're supposed to do or what people tell them to do that have no knowledge, right? Segue.
Yeah. Well, I mean, that's the thing is Dale, one of the things that get us talking quite a bit with a mutual colleague of ours who couldn't make it today, but we've promised to make fun of him terribly.
Ad nauseum, yes.
So what was really interesting is James Dondo, shout out to him. He's also a former massage therapist who turned paralegal. And so we got into our own special group. We're special, Chris, right? Where we're just sitting and
that is a narrow niche, probably.
Well, we've had a chance to talk, and the thing is that Chris has been really good at helping us articulate some of our rage, for lack of a better term.
I was going to say inner dialogue.
Yeah, that sounds more.
Well, we both of us found ourselves drawn into the legal side of things fairly early on in our massage therapy careers. Like I spent a couple of years as soon as I graduated on the college. So it's crazy how many people, members of the general public, don't understand that what it means to be a professional is to have a license.
Yeah.
And those licenses are regulated by state or provincial boards. And they typically call themselves colleges, like College of Physicians and Surgeons, College of Nurses. There's also the College of Massage Therapists. And we were regulated under, well, he still is. I'm not.
Correct.
College of Massage Therapy College of Massage Therapists of Ontario. But there's also a professional group. And those are more advocacy groups that I feel the general public can often conflate. And you'll get a big kick out of this, is once upon a time, right, my first year, I had not joined the RMTO, the professional advocacy group for healthcare massage therapists. And I was, seeing patients, and they were submitting to their insurance companies, and I get these calls, and they're, well, we can't find you. And they had insurance companies did not know where they were supposed to look to find my license. They're like, well, we've looked on the Registered Massage Therapists Association of Ontario, and we can't find you. Well, I'm not there, but I am regulated, and I am a practitioner, and you have to go here. I had to direct insurance people, I know for sure 3 separate occasions, but it could have been more in my first year.
Yeah. And obviously we see that it happens a lot, right? Where people in insurance maybe been there for like a couple days, we'll say, weeks, months, whatever. They don't understand the differences. So they may have been directed once, and they think this is the place to find people. And it could have been an RMT. It could have been another colleague. But they didn't know that there's more than one place. And there's actually only one place to check to see if the person is currently registered, which is the college. The association, it's not even a mandatory thing. It's a voluntary thing to be a part of, which, that's a whole other issue. But it is not there for everybody, because not everybody is in it, but everyone who is an RMT must be with the governing body, the CMTO. So that's where you're going to find them. And people don't know that.
No.
Especially in the professions that should. Like, you're an insurance company checking up to see if someone's registered. So if they're messing that up with us, what are they doing with physicians, nurses, chiropractors,
dentists?
Whatever. Right? As we know, let's throw out there right now. The manual osteopaths of Ontario and across Canada are not regulated by any college, just associations. So if an insurance person thinks that by contacting or looking up on the association that they're going to verify this person is registered, they're going to be dead wrong, because they have no college. There is no regulation in that regard. They're just subjected to voluntary service with the association so that their name can be on a list somewhere.
Yes.
Really, for osteopaths?
Yeah.
Interesting.
Yeah. And there is a really big difference between osteopathic, like surgeon doctor, which is licensed by the board. And that is something that you can see in Canada and the US. And they are typically surgeons that are in doctors' practices and whatnot. But then there's this manual osteopathic practitioner. And typically you'll see them as a massage therapist or a physio, or have you seen the odd chiro who's done this additional training? And is Andrew still, was that the name of the man who started osteopathy? You'll like this. So. Yeah, 19th century journalist. That was his background.
That's interesting.
There's still a point, like just at the base of the skull, they call the still point, which is basically named after him.
Oh,
yeah. And
what she's getting at there, like the difference, like a lot of times in the public, it's osteopathy, but it isn't known that there is tiering to it, right? Like, so the doctors of osteopathy can perform surgeries when they have been given the right to. In Canada, they must have been trained at least in the United States because there's no training here. So the manual means that they are only doing things through manual manipulation. There is no surgery involved. There is no hospital privileges, and there is no regulation. So,
right.
Yeah. And some of those colleges for manual practitioners still believe in visceral manipulation. Notice his brow furrowed.
I'm like, what?
So they literally believe and teach that they can move around your kidneys and they can move around your liver, which is huge in your body.
More importantly, that they can move around the organs and permanently change their position, not just move them around. Like if you're say like,
not just
pushing
wiggle
your stomach and you move your guts around or something. Okay, cool. But it doesn't stay there. It goes back.
Yeah, it goes back.
And they are also huge practitioners and proponents. Well, not all. Thankfully, there are some more evidence-based osteopathic manual practitioners that I know who are quite good, and they do care, and they do, like Frances Tregurtha, for example. She's really careful with what she does. So shout out to her. We see you, girl. We know how hard you're trying. But there's also people who believe that they can take the fissures of your cranium and shift the bone plates
of your skull.
Manipulate it.
Okay.
Which, if you talk to a doctor, are fused and cannot move.
Exactly. Yeah. I mean,
and if you could move,
I thought that was
a problem.
Common knowledge that they were fused.
As a reverend, you know that.
Yeah. Right. Yeah. Yeah. My genealogy background told me a lot about the skull.
Yeah. Yeah. And one of the issues we face is because there is no governing body, that means that every school is its own association, and they have their own rules and their own like ideals and teachings of what their capacity is and how much their scope of practice is, which apparently is very broad for some of them, but there is no actual scope because there isn't a regulation. You can only have a scope if you're regulated.
Interesting.
And in Europe, there's been more of a manual practitioner movement, and you see it especially in the UK and France. But there's training as doctors as well, and it's very symbiotic. So one of my British friends said, when we were talking about it a number of years ago, she goes, well, that person was a medical doctor but wanted to be more on the physical therapy side of things, so did osteopathic training to help his patients with essentially be a cross between a family doctor and a physiotherapist. And I said, well, that makes way more sense to me. That doesn't exist in Canada. And she said, oh, really? And I said, no, I don't know of anybody in Canada or the US who actually does that, unless you do, Chris.
I've known of a couple of people that have actually trained in Europe, come to Canada, and they've gotten their, training so that they can be official here, but they still hold on to their European training and do it differently.
And this kind of goes into our broader discussion that we and some of the things I wanted to bring Chris on today to discuss mediation in this healthcare provider dramatic world where there's not a lot of legal knowledge, and unfortunately I know that there is not a lot of legal training for medical healthcare practitioners. I know some nurses and doctors and whatnot, and we've even had discussions on, well, do you know what your legal obligations are? And they sort of know what is expected of them more through an experiential than they have Law 101 for doctors, Law 101 for massage therapists, Law 101. There is no law class for healthcare practitioners. And we've been noticing what a big problem that is. And I don't know, Chris, if you want to launch into all of the stuff we've been.
Oh, that'll take several episodes. what I'd say, like, some of the schools are getting better, especially now that we have the accreditation, that there's a push for that. So the ability to have like more law focused is starting. But traditionally, like, and be very blunt, the vocational schools that have started and been in existence since like the 80s and then the 90s and whatnot. Now there's like 50 schools in total almost across Ontario that all teach different levels. I taught at a school, one of the vocational schools early on, and we had the professionalism and ethics class where we taught some of the laws, but it was very brief as a component within this like single class, one semester, like 3 hours each time, and you had to cover everything from like how to handle yourself in a situation meeting new people to the laws to like whatever. Yeah. And some of the scenarios and whatnot had very little to do. So, and that was the very first thing. And then what generally happens is people put that aside because they're really interested in doing the hands-on part. So they don't keep that. They're like, it's not held in like the way that it should be. So we see this a lot by the time people are out and they start asking questions that to some of us who maybe have taught it or have looked at other things, it seems like it should be common knowledge, should be simple. But because it was essentially so long ago in their training, they've forgotten, or they just didn't
or
even
not really covered. As you said, with all the different ways of approaching in these schools, we have no real way of telling, because the CMTO dictates to the colleges only, these are the things that you may find on the exam. And unfortunately, a lot of these vocational colleges teach just to the exam.
Yeah. And what I find too, like, again, unfortunately to an extent, is that there's a lot of like, I was taught by someone who was taught by someone who said this is true. And there's an extent, like, it could have been true back in the 80s, back in the 90s. But as we know, laws advance, policies advance, standards advance. And if someone hasn't kept themselves up to date, they're teaching from knowledge from like 30, 40 years ago, and it's not relevant. And so when people get out, they still are holding on to this former knowledge that doesn't apply because their teacher said so. And unfortunately, that seems to be where people rest a lot is, well, my teacher said so. But that's not enough. You need to, like, this is something we've said before. You need to be ready to unlearn some of the stuff from school and actually bring yourself up to speed, because things do change. We know that the laws, the policies, the ways of looking at things change, sometimes yearly, sometimes in a 5-year or 10-year stretch, but you have to know what's current. And not a lot of people do that. They get left out, and then they're asking. And then when they hear, again, answers from a lot of different sources from people who have various levels of current or out-of-date knowledge, and they don't know whose is the most accurate. And it sends people all over the place. So, and this is not, like I said, not just the one profession, but many of them, that there's a lot of mismatch of knowledge and ways of doing things because of my teacher said so.
And then add in all of the problems of the fact that what I've learned coming through my paralegal and legal training now, before I became a mediator, was discovering, because I had experiences as a massage practitioner of lawyers requesting my notes and my treatment notes and whatnot. And I learned things, but there are very few massage therapists who may ever experience that. And then I learned that the lawyers don't even necessarily know what they're asking for and what they're looking for. And this could be a very big case. And a really good example of this is, let's say someone goes down the street on their way to work every single day, and then they get into a car accident. Not even their fault. Someone crashes into them and they get whiplash from it. And they've seen Chris. They go to Chris as a massage therapist he's seen this patient for maybe several years, But now there are all of these new things that have cropped up from whiplash. So he does certain intake. There's certain protocols. We don't need to talk about it, although I'm sure we could spend a long time talking about that. And he does certain additional protocols that will happen, different notes. He has a different way of doing it than, say, maybe I did when I was a practitioner, that someone in Toronto did, that someone in Ottawa did, that someone in Thunder Bay or Sault Ste. Marie did. And then something happens, the insurance company decides not to pay out, and they go to a lawyer, and a lawyer says, you have a really strong case here. I think we should take this to litigation. Who have you been seeing? And they don't even sometimes think to come and see the massage therapist for a really long time, which makes me scratch my head. I'm just thinking, why not? Because the massage therapist is the one that's actually making probably the most. In fact, I would be willing to bet money that they are probably the only healthcare practitioner that is actually providing skin-to-skin contact, palpating the areas of injury, assessing the actual sites of injury, and looking at the measurements of progress of whether they are actually progressing in their healing or not. So learning from lawyers and discovering that they don't even know what they're looking for. They just want a massage therapist to hand over treatment notes. Then discovering that many of my former, but his colleagues don't even know what to send to lawyers. There's this massive chasm of knowledge gap. Then now let's add in healthcare mediation, which is starting to grow. It's quite big in the States. It's hitting Ontario and places like Toronto and whatnot. And what it really is usually it's in-house insurance companies hiring a private mediator or their HR who's taken a mediation course to come in and try to essentially form a settlement. And so one of the things that has really raised my flag is, okay, is this patient really being served by this mediator? Is this patient even aware that their massage therapist could probably be the best advocate for signs of needing more insurance and complete funding? But then how do we let massage therapists be aware of the kinds of things? This is the kind of thing that I love talking to Chris about as well. But we had quite a large group of colleagues who were trying to tell other massage therapists, you want to be tracking these things. These are the kind of legal ramifications that you could be getting into. And it's not even just my teacher said, which is it's a salient point. There's also, well, I work for a chiropractor, so I don't need to do that because my chiropractor's done it. I just massage them. Do you want to open that can of worms? I could talk. So how about you go there?
as we know, and this is where, like, you know, again, any of the professions, there's a variety of ways people actually approach things and do things. And unfortunately, there does seem to be a fair number of RMTs that kind of get brushed aside with, you are just doing this, almost as if we're assistants, that we just follow the plan that has been set by someone else, not realizing that as a primary health professional under the RHPA, you know, one of 26 professions recognize that we can be the primary of our own treatment plan. We don't have to follow someone else's. And if we have opinion, we can come forward with it. But unfortunately, a lot of therapists think that they may work for the other professional, and there's a variety of different ones that are out there, and that they have to follow that plan. Or in some instances, and I've had this done in my career, where I was actually told, all I do is massage. Don't assess, don't give home care, you just massage. And that was not a good situation. The person actually said I was wasting the patient's time by doing assessment. But honestly, how do I know what to work on if I don't do my own assessment, if I don't do my own planning of treatments, if I don't do my own follow-up and home care? I can't do that. I'm not an assistant. I'm a primary professional. Even in the case of assistant, like a physiotherapy assistant, chiropractic assistant, whatever, they do have the ability to make some changes here and there, running it past the primary therapist. But, sometimes RMTs think they don't even have that. They can't communicate. But in reality, we should be one of the primary people sitting at the table. We know a lot, like she was saying, is that we spend so much time with that person one-on-one, and because we're not using assistants, we're there for the whole thing. We listen to people. We have much longer time to figure out things with them, whether that's assessing or treating. So our knowledge of what's going on with that person can be a lot greater, especially in the lines of someone say they slip some information that they thought was irrelevant. And then all of a sudden you're like, why didn't you say this to anyone? Why did you not consider this relevant? And you bring that forward to the team. And it only happened because of how much time you spent with them and they brought it up. Mm-hmm. So our value definitely, I think, needs to be elevated with some people. Like the insurance company, as an example, would be good. That understanding that we have a great deal more knowledge sometimes than someone who has spent a little bit of time, right?
2 minutes.
I don't want to drive to exact, but like a specific type situation would be if someone comes in, does a 5-minute assessment, and then they're with an assistant for 30 minutes. But because that assistant is just an assistant, they'll never be called.
Exactly. Listeners, great example that has happened to me this week where I got de Quervain's. A lot of people don't know what that is, but it can be very common. It's not carpal tunnel, because that's the thing that people think of right away when it involves your hand. And that has nothing to do with all the other potential things that could be going on with your hand. De Quervain's, the newest term for it in layman's is called texting finger. Okay. So I got an inflammation of the ligament and tendon area in my left thumb. I'm left-handed, so it's a big problem. And I kind of ignored it for a while. So of course it got much worse because I do that. And I was in so much pain, but I couldn't explain to my husband how to splint my hand in the correct way because I only had one use of my hand. I couldn't do it to myself. So Chris was kind enough to actually get on video conference and show and help my husband. Like, you want to do it like this. And he tried and it worked. But once he finally understood, because Chris was saying you have to get this kind of crisscross, and he had to show him and demonstrate a couple times. And the moment he did it correctly, instant relief. Chris was in London, Ontario. I was in Ogdensburg, New York. We did this over the phone. I mean, send me the bill, Chris. But it's like $120, please. But the thing is he knew, he had experience. He worked. He showed me how to do this. But I knew in case this gets worse, I'm going to have a formal diagnosis. So I made sure to go book an appointment with my GP. I love it. Shout out. Kieran, if you're ever listening to this, you're a great guy. You're a great doctor. I love it. But you're so chill. And he was so funny because he comes in, he's like, okay, CT, what can I help you with today? And I said, I think I have de Quervain's. And he wasn't one of those doctors that treat massage therapists like we don't know anything. He was like, okay. So he walks over and he squeezes right at the anatomical snuff box. He goes, does this hurt? And I'm like, yes. And he goes, can you do this? I said, not without there being pain. Can you do this? Not without there being pain. Okay, you have de Quervain's. Thanks. And he's like, put Voltaren on it. Totally different experience, because Voltaren is okay, but I need that compression. And without that type of manual practitioner experience, those are the kinds of things that I think a lot of people undervalue massage therapists for doing. And then we throw these massage therapists into multi-practitioner work environments where I love what Chris brought up earlier about, oh yeah, you're just supposed to massage them. You're not supposed to do anything. So we've seen, and this is not to be derogatory towards other manual therapists, but we've seen a lot of physiotherapists and chiropractors treat massage therapists as lesser than, as a way for supplementary income, and they fail to provide appropriate contracts because there's this gap in legal training. Massage therapists sometimes think, oh, but they're, doctor, chiropractor, they're masters of physical therapy, physio PT. So I have to listen to them. And if they tell me just to massage this person's neck, even though they have a foot injury, I'm just going to massage their neck. Right? And
I would say that's probably something that causes issues now and then for me, is that I'm willing to push back and say what I think and not just do what has been told or even accept a diagnosis as fact. I'm going to go and do my own assessment. I need to know, do I think you're right? If I can verify it, then sure, I'll pick up a treatment plan along with you. But if I don't agree, then I'm going to change up my treatment plan. I'm going to present it to the patient, ask them if they're okay with it and if they agree to what I want to do, and go from there.
What?
I know,
Ask
right?
a patient for their input on their health? What?
Sorry, did I bring up something hot there?
Well, I think the thing is there's a lot of disempowerment that happens in the medical field, and that's another thing that I really like is, have you had any of those experiences?
I personally haven't had much of that, but it's a common trope in television.
Yes.
Or, like Grey's Anatomy or one of those shows where someone comes in and they're like, I'm telling you, I am feeling this thing. And they're ignoring them over and over again because they're the one that is educated in it.
Yes.
Yeah.
Yes. It's so common. And it's a real thing. It happens all the time.
Yeah.
And when RMTs feel disempowered in their workplace, the biggest issue that Chris left on the table just a while back ago was, okay, so let's say they don't do what Chris does and they go, okay, I'm just going to massage this person's neck for the foot injury. And they keep doing the massage. Now a legal issue comes back where an insurer comes back and questions that. And the patient wasn't empowered to make the decision. And the physio goes, well, I've maintained my records and I've done my assessment. I'm totally okay. And then the insurer looks at the massage therapist and goes, why have you been massaging this guy's neck for 6 months when he had a foot injury? A car ran over his foot. Why are you massaging his neck?
Yeah.
And if you hadn't really been doing that assessment and reassessment and all of that home care and REMEX aspect of it, and you're not being diligent in your note taking, what are you doing? Chris, just drink water and take an Epsom salt bath.
Oh, dear Lord.
It's funny you said the Epsom salt thing, because that was what my dad had to do. So my dad has CMT. I don't know if you've heard of that, Charcot-Marie tooth. It's a very rare neuromuscular disorder. And my whole life, usually once a week, he would have to soak his feet. And I was like, that is doing absolutely nothing. I mean, it's maybe drying it out because of all the salt that's in there. But
yeah. It's amazing what people have been given.
There's all sorts of theories behind it, but I don't think there's been actually anything scientific to say this is what this does.
Yeah.
The main thing we can rest on is it's heat, and more we're finding out that heat is the more appropriate thing. I get to throw in here that even the person that coined the term rice, there's still a place for ice your extreme pain, it's the first 12 hours, things like that, that you can read upon. But what we're finding for like the long term is heat is going to be the most beneficial. It is what seems to have the greatest effect, because one of the things that has been noted is that as much as everyone loves to do ice, is that it actually blocks information through your nervous system. So it doesn't know what's going on. Your brain doesn't know what's going on. It doesn't know what to fix. So the idea of an Epsom salt bath, it may not be the salt. Again, the jury's still out whether the ions do anything or whatever, but the heat is the most common thing. And between a lot of different therapies people do that, gimmick, not gimmick, doesn't matter. You look at the commonality, and a lot of it is heat. That this seems to work well with the human body.
What about one of those recommendations that you love to hear, the detoxifying your tissues through massage?
Do you have a liver? Right. As we know, if you have anything toxic, like actually toxic in your body, that's a poison. And that requires something to actually remove it that has been introduced from the outside, right? So like anti-venom kind of thing. The idea of what is called toxins is actually just waste product, a byproduct of cellular respiration. And different degrees of that will accumulate or dissipate depending on, again, activity levels. Like you've just exercised, you got a great deal of it. You feel that quote unquote lactic acid, even though that's not what it is. And you think, oh, I need to detoxify. No, you just need to let it run its course. There is no toxins. It's just a byproduct of living, moving through the day in different ways. There is nothing that can actually flush toxins. So, it has to be an anti-venom, anti-poison, something like that from the outside. Nothing.
What about my essential oils, though, Chris?
Yeah, I know. So, again, the liver,
they smell good.
Kidneys, things like that, that filter things out of your body. Those are the more important.
Yeah.
The different vitamins, minerals, foods, and whatnot. Yeah, we have homeostasis that needs maintained. That is something. But to tell someone like, yeah, that water is going to detoxify you. No, that's an erroneous claim. If someone is thirsty, they're thirsty. Do they need water? Sure, not for me to decide. That's something for you to decide on your own. Because this takes us into a different level. Some people think they have to say that every time, but they don't know, and they don't even ask. They don't do history, for example. How much water do you drink every day? They don't know if they're actually adding just a little bit too much or what else is going on. And that may be, bad, because there is actually, issues where someone can be overhydrated.
Yes.
Like you get hyponatremia, where you've got too much water in your body and not enough calcium chloride or potassium, sodium, things like that. So the natremia comes from the sodium. But you have these issues from overhydration. And what if that's what you just put someone into because you don't know their history?
I think I have felt that before. Like when I was, trying to, work out and lose weight and everything. And, someone said, well, you have to drink this amount of water every day. And I tried to go from hardly ever drinking very much water to all of this. And I felt terrible. Just really,
What's
really
not
terrible.
realized there is there's a lot of sources of water, like a lot of food we have. If you look at the contents, get past all the fun stuff you see online, but what they miss is how much of it is actually water content. And unless there's a diuretic present, you're going to absorb that water. You're getting your water from various sources, not just a, glass or a bottle or whatever. So you don't know if those 8 cups of water you just drank is on top of another 3 cups that you just ingested through food.
Right.
And I know I've had a lot of past former colleagues, and it used to just irritate me all the time when they said, Epsom salt bath, drink more water. And that was all they would do. And if I would challenge them on it, they would just say, well, that's what my teacher said, which is what Chris brought up before.
I was literally going to say that's what I was taught in school. And then eventually I got past it being like, this makes no sense.
Yeah. And the thing is when I noticed them not doing this evaluation, reevaluation, and setting any type of treatment goals, not only could it increase risk for them, because we brought that up earlier about how, if an insurance company starts asking, then their license could be in trouble, because an insurance could look like any insurance who might know and have experience working with massage therapists could go, this person is a load of hooey. I think I'm going to make a complaint that this person is maybe doing things out of scope or not performing to the standard of care that is set up. Mm-hmm. So now you have to go through that complaint process. But then also what they could be doing, as Chris mentioned, about these, maybe someone is overhydrated already, and here you are telling them to hydrate more and making them feel worse. So how are you serving the patient? And we should probably talk about the fact that I keep referring to them as patients. And you may hear even licensed massage therapists, because the difference, listeners, if you don't know what is an LMT, what is an RMT? A registered massage therapist is someone who has their license from a professional college that is giving them their license. Same with licensed massage therapists. They have passed a state board. They are out there. Not all states are equal, just as not all provinces are equal. So there are some issues there. But if you go and look at some of the requirements of, for example, New York, Texas, Ontario, BC, you'll see that there are certain qualifications. And Chris, Dale's from California. Yeah. So I'm...
What is that?
Oh, I know about the Californian system for massage therapy. A friend of mine went through California college, and she had to do an interpretive dance on how pain made her feel for her college program. She also had to draw a picture of what money was like for people. That was fun. Yeah, and it was about...
It seems very helpful medically.
Yeah, 400 hours, whereas we have 2,200 hours for our training.
Mm. Well, so and I'd throw difference in there that, the hours equivalency. What really should be stated is that in Ontario, that we have the equivalency of 6 semesters, so 3 years of college. Mm-hmm. Education, which involves a lot of pathology, kinesiology, anatomy, the whole bit with the sciences. And we have that much in there. It's so 2,200 hours for someone who doesn't understand, it is the equivalency of 6 semesters.
Mm-hmm. Not interpretive dances on pain. We didn't do that. Yeah. I don't know. Well, Chris, did you do that in your college course?
No. No.
We learned about what kidneys do.
Yeah. But surely what that person got wasn't like an actual, it's not an accreditation to the same degree either.
Training, and then what she had to do was take the Californian state exam. And when she passed, then she could practice as an LMT in California. But the requirements were all I was trying to outline there is that the requirements are very different states. In Quebec, in Quebec, it's just as bad. It's only, I think it's 400, but it could be only 300 that you need.
Is that in order to practice as massage therapy in a medical setting? I mean, anybody could just have a parlor or something.
No, that first of all, we won't even throw parlor in the mix. That doesn't come up. First of all, to do the full education in Ontario, all that really does get you is the ability to challenge the board exams. You can't even practice. You have the ability to challenge the board exams, and if you pass, then you can get a license. Mm-hmm. And then, you have to pay for it, and then you can practice. Yeah. But you don't just pass school and then start working. It doesn't happen like that.
Mm-hmm. Right. Now, you have to then get the license.
Yeah, but for us in Ontario, no. It only gets us the right to challenge the exam.
That's what I was wondering, if in California there even is a license. Like,
there is,
like if you practice without a license, is there any legal ramification to that?
I don't know. That would be
otherwise really anyone could practice, and it's just a matter of their clients doing due diligence.
In Alberta, for a long time, all you had to do was have schooling, and then you went to City Hall in your district, and you just paid for your license to practice. You didn't even have to take an exam. That was Alberta from a long time ago. I don't know if it's changed there, but that's very similar to what happens in Quebec as well. Is there's no actual examination or professional regulation. It's just you took a course, you go and you pay for insurance, and you can also register with the more of the advocacy type of association. Right. Quebec has one. I have no idea how common or prevalent it is there. I just know that they have some great massage therapists who practice. But in meeting a few of those colleagues, they say, unfortunately, it is there's a lot of sex work masking as massage in Quebec, and it is a big problem.
Yeah. That's true everywhere. Yeah. But I guess because I know
it's not true everywhere. In Ontario, it's not.
Sure, CT.
Yeah, and that's one of the things with like the education levels that we throw in the mix, is that the longer that you're forced to take schooling, the more it weeds out someone who just wants to quickly get that license and start doing whatever the heck they want.
Right.
It weeds that part out. Whereas like if it's a weekend course just to get a license to take to the city and say, hey, I've got a certificate as a licensed therapist, but they never had the intent. They just wanted it to have it put on their window. The longer the education, the more it does weed people out.
Yeah.
So
we're going through a really interesting time, because during COVID, when we all went into lockdown, massage therapists were prevented for, what was it, almost 6 months, really?
4 months.
Yeah.
We were March, April, May, June.
Yeah. And so that inability to practice really threw a lot of people. I knew someone who had just bought into a clinic like a couple of months before the lockdown happened. So suddenly owed loans and various things. And overnight,
I could do nothing about it. Yeah.
Wasn't sure if they could continue to practice. And I knew a lot of people who just immediately retired or pulled out of school or changed into something completely different. Just because they had to reassess their situation and their reality. And what I saw happen is a lot of really good massage therapists decide to no longer invest in their licensing. So they retired and then continue to practice as a massage therapist, but they can't, in Ontario, they cannot use the title. That's a protected title, comes with a $10,000 fine, massage therapist. All they can say, call themselves a muscular therapist, a massage practitioner. And what's been really interesting is watching how it skewed some of the expectations in different areas. And I think it's made some of those workplace issues even more difficult for someone who isn't like Chris, who's diligent enough to learn the laws and work on things and navigate and advocate. You do a lot of advocacy and mentoring, but there are people who go, oh my gosh, this is too much. I think I'm just going to let the chiropractor dictate to me what I'm going to do. And that can lead to a lot of problems that patients aren't even aware of. So what do you think they can do about it, Chris?
The individual therapists?
All of them, everyone, the whole wide world, Chris. Tell everybody what to do.
The main thing is to understand what power you do have and where it actually ends. So, and in some cases, yes, it's a legal endpoint of what you can do with the power that you have, but don't sell yourself short when you've got a position where you are empowered. So again, back to what we have is you can assess, you can make a plan, you can implement the plan, you can actually discharge a person, start another plan, you can involve other professionals, do your referring out, do like collaborations. Don't sell yourself short as someone who just massages and does it without like intent or knowledge. Just, so like, for example, the person coming in, I've got this and that, but I just want to get rubbed today. Well, no, I can actually help you figure out why, and maybe make it so that you don't have to come in as often or see other therapists as often, or continue to just feel the way you feel because I took the time. People need to understand what power they do have and exert it, not just have it dictated to them and told that they don't have value when they do.
And also the patient as well. There's so many things that have someone determine why they're going to see that healthcare practitioner in the first place. Sometimes it's just convenience. They got into a car accident. They Googled and they discovered that there was a physical therapist office around the corner. And then the physical therapist that did their assessment goes, hey, I think we're going to book you in with Chris, and so you're in pain. You want to get out of pain and you've never tried massage. And you're like, well, okay. And I think that could be potentially slippery slope for the general public. So Chris, if you could be for all of the people who might want to seek a massage, what are some things that they need to navigate and know that they're empowered to do before they even come through and see you or see someone of your ilk?
The first and foremost, like for patient advocacy, patient empowerment, is that with any of the therapies, they are the ones who have the final say. We can make suggestions, we can give you guidance, but a patient always has final say. That is like the cornerstone of the whole idea of having informed consent, is that the person can say yes or no. So if you're the patient and you're going in, you don't agree with something, you're allowed to say no. And I personally, I don't know about all therapists, but I personally will not take offense to it. I won't agree with your choice if I decide something else, but I'm not going to take offense, and you can try what you want to try, because that is what it is to be an empowered patient. So part of that is that when you are part of the plan, you can ask questions. You can seek guidance as to why things are happening. The person who is the therapist should be very open to telling you what they know, and even telling you what they don't know or what's beyond their scope at that point, and not keep things secret from you. Be able and willing to ask questions at any time and not feel that you can't. That, that whole idea of like, there is no such thing as a dumb question. There's just questions you don't know the answer to. So ask them. That's a part of our job. A big portion is to empower you with that education so that you can then continue to make good decisions. So if anything more than that is the patient has the ability to guide their own treatment plan.
And just to be clear, you don't perform surgery.
Correct.
But what if they want surgery from you, Chris? They like you. They think you did so well. Why you just
that is most excellent. However, it's still out of my scope of practice, so I would have to refer them elsewhere.
And I think the thing is also you have people. I'm sure this came through your door as well, but I worked with a lot of people with persistent chronic pain issues. Primarily because I had it. And that's what drew me into massage therapy, is I found it helped relieve and manage my pain. So I wanted to help other people. And so I ended up seeing a lot of patient dumping in my practice, hence why I was always looking for referral sources. And I found that I got very strong in knowing when to tell someone, I'm not sure that I'm the best practitioner for you. It didn't necessarily line my pockets to tell somebody that, but I knew I was serving the patient better by saying, I think we should go and look at this. You might want to go to see this person. You can come back. Happy to see you again. But I've noticed the reluctance for people to maybe even know and feel strong enough to refer someone else out for sex work. We were just talking about this recently, and I said, you know what I find really interesting is in Canada, it's not that it's legalized per se, but it's definitely decriminalized sex work. So more and more massage therapists are always terrified of getting, that client who's masking as a patient who is actually looking for sex work. And I think it would behoove massage therapists to go, you know what? I am not Chris, the happy ending person. I'm Chris, the RMT. Right? And I think that would be really important for them to say, here's a card. Go see this person. This is the person you want to see, because I've seen a lot of regulation on massage therapists, especially on Ontario, that seems excessive almost, where it's become too restrictive to the point where I think massage therapists are even terrified to bring up to the patient, I think what you're looking for is a little bit off.
It's probably a touchy subject. I didn't even think of that. I mean, it's an interesting. I never considered that because in California, especially, it is still so criminalized, the sex work portion, that there is no misunderstanding. If you're seeing the physical therapist type of any massage therapist, there's no happy ending. That is not anywhere on the table.
Oh, but people will still try. Like, even I knew massage
some creepy
therapists.
People will still try.
Well, no, I knew massage therapists. There was one. I mean, this happens everywhere in North America, even in Ontario. But there was one LMT working in a large, well-known gym in downtown LA somewhere, and they were more of the sports massage person, and they went by masseuse, Chris. They called themselves a masseuse. We hate that, by the way. Yeah.
I could see how that could, throw some confusion possibly into the...
And he had a lot of problems because there were a lot of women propositioning him while they were on the table. And he didn't know how to handle it. And that he was thinking of leaving the profession. And unfortunately, male therapists are in a very, I very strongly advocated for my male colleagues when I was a massage therapist, and I still do it now, because I see the fact that you still decide to be a regulated healthcare massage therapist, Chris. Kudos to you, because honestly, it's restrictive. It's there are some problems, and there are some very dicey situations that male therapists have to be very cognizant of. And I think we need to be a bit freer, more expressive to say, not honey, you can't belittle the patient, but they're coming to you for services that are not within your scope. And that's a really easy way to say it. It's like, that's not within my scope. I am not going to be touching your genitals today. You can be very bold about it.
Probably should be, And the more professional you are, the easier it is probably to make that distinction.
Here you go. You can go see this person who would be very happy to touch your genitals.
May not even have to pay for it.
Right.
I think go. Yeah.
No, I was going to say, I think what we get at with that is that idea of the professionalism.
Yeah.
Don't, as much as some people will or want to, or however you want to say it, react emotionally that someone has asked this of them. They don't understand maybe what's going through that person's their brain, their relationships at the moment, things like that. Like we even had this discussion the other day that a large amount of people who are quote unquote looking for sex work are actually looking for just companionship, someone to listen to them because they're not being listened to in their life. And this was an interesting stat to find out, is that a lot of people do just end up going to talk, as much as it seems like it is.
That makes sense. So, yeah.
And it's a non-judgmental. You're not in a setting that you're worried. You're going to be open with them and get that, that feeling back of maybe being wanted, normalcy, whatever it is you want to call it. So if someone is approaching a therapist, it doesn't even have to be massage therapy. We get the bad rap for it, but there is a lot of different professions that someone may feel comfortable enough and try to bridge the gap with the question. And the therapist needs to be in a position of being empowered themselves, that the professional clinical approach is the best way to shut it down. So that idea of like having a referral ready. And when we're looking at places where it's not decriminalized, it's still a criminal thing, it's still illegal, maybe even the idea of just, maybe you need to go see a psychologist or specifically a sex therapist, relationship therapist, and discuss what your options might be. Because that is their job. And as far as a legal job goes, right, they go into a sex therapist to talk about what might be going on and what your options are. And as the RMT, a kinesiologist, manual osteopath, even like esthetician, it doesn't matter. You just put your foot down that it is just the professional side, clinical side of, well, I don't do that. So what I'm going to do is refer you to a different person to maybe unpack this and discuss what your options could be, but that's not going to happen here.
Yeah, absolutely. And maybe also take away some of the social stigma of it and
100%
the shame of it. And it's like, I'm not judging, maybe not say it, but the way you act and explain it to the person is in a non-judgmental way.
Yes.
Like, this is fine, but it's just, if this isn't something that I do, I can help you with a referral to this person.
Right.
Well,
and because it is, because it is so taboo, right?
Yeah.
People don't know what their options are. So they get into a situation where they feel comfortable enough to be open that they may ask the question. They may think that this is okay. They don't know they have options. So as the therapist, as the professional, being able to hit it clinically and say, here are some options that they may not have known about. And the first one, yes, go to somewhere like, in that case, legal, and talk to someone who that's their job, is to help you navigate those feelings and what might actually be going on.
Yep.
Yeah.
And I practiced in a tourist town that was very close to the Quebec border. So we had some Quebecois people legitimately thinking that I was somebody who they could seek out for sex services.
Wow.
I had a call. I think it was a Friday night or a Sunday night or something like that.
So just because I don't know. So is it legal in Quebec? Or why would they have? Why would it be different? It's
so common to have massage parlors, which we don't have really in Ontario. I mean, there are ones that are kind of, erotic massage and da-da-da-da-da, but it's really clear and delineated. But because they don't have the same level of standards for therapy in Quebec, and it's all a little bit of mishmash, I understand how, a Quebecois tourist could, maybe it's their first time in Ontario, maybe it was their first time in Gananoque, coming down and going, feeling a little randy tonight. Maybe I can just go and book a massage. And it was very weird as somebody who was the Ontario trained practitioner to suddenly get this call and not really quite know what it was, and then have this question asked. It's like, oh, yeah, no, these are not my clinic hours. I'm not open right now for a walk-in. You're going to have to maybe go somewhere else. Okay. And that's it. I mean, it was a bit weird. It was a bit funny, but I didn't suddenly have to rush over to the police and file criminal charges, this person didn't know any better, and it was really obvious to me. But some people, like, as someone who's a survivor of sexual harassment and rape, I mean, I've had to do a lot of work, but I also understand that there's a lot of men and women who've had trauma in their past, and then they've stepped into the clinical therapeutic role, and it scares them. Like, just even the mention of it is scary. So I understand it's a big hill for them to cross, but it's something they need to practice.
And I can imagine if you're a professional massage therapist, you want to disassociate yourself as much as possible, I would think, from...
Yes, and yet at the same time, as someone I'm very sex positive, and
well, you can be, but it's just not what that's not what your job is. Yeah.
Like Chris is like, I'm saying nothing, my lips are sealed. But the thing is I did have some colleagues who blurred the lines. And at the time I was very judgmental, very judgmental. But now I look back on it and I thought, you know what? They made a lot of money.
It reminds me of that episode from Schitt's Creek when Patrick accidentally gets David.
There you go.
Yeah. All I did was give him a bunch of cash and tell him to take care of you. And now that I think about it, the right type of person might have taken that the wrong way.
Yeah. And the thing is that the hardest question, I think, especially someone like an Ontario registered massage therapist or a New York licensed massage therapist or Texas, people who have more schooling and more health care legislation with them, they just need to ask them, do I want to be a clinician and a clinical therapist and want to make sure that I have that divide? Or do I want to maybe not be a clinician and not have the RMT or LMT designation and go into something a little bit more
hands-on,
fulfilling? But also, one final question, Chris. We were touching on the patient experience quite a bit of. I'll give you a great example. Like, before I knew my spine was broken, 1999, I had this issue, a lot of problems, and I was seeing a doctor. And back then, it's when OxyContin was quite easy to just prescribe. And I was 24 at the time, and she wrote me a prescription, a lifetime OxyContin prescription, and muscle relaxants. And she said, just don't do anything. And there I was walking out of it. I actually went to the apothecary, the drugstore, and I had a pharmacist start to fill this out. But in the back of my mind, I thought, oh my gosh, something feels off. And I went and got a second opinion. And that took me down a totally different path. But of course, now we've seen what OxyContin did to people and how it's killed people, I know, and how there are people who are in drug recovery programs from it. Yeah. And sometimes I catch myself.
Kids in LA would sell it to each other. Yeah. Steal it from their parents.
Yeah. I catch myself thinking about that time. I mean, what if I'd started taking it? What would that have happened? And how does somebody who goes from, because I've seen it, I saw it happen on my table sometimes. A patient come in and they're telling you something. Well, my doctor sent me here for massage because they think da-da-da-da-da-da. You're going through, how do you, so it's this is a tiered question. Sorry. I'm just going to ask you everything.
She likes to do that.
Yeah. So a patient's walked in, there's something that they're questioning. There's this flag that's gone on in their head, but they're still a little bit not sure. What are the what are the steps that you would do to help empower that patient and help them mediate and navigate some of that gray territory?
I would say, first of all, it depends on how the patient presents it and when, because sometimes it's going to take a while. They have to develop that trust of their therapist to actually bring up the questions. But when they do, it's that the knowledge of what else is out there. Where can we refer them? Where are some places that they can advocate for themselves and look towards? And I think that it does come back a little bit to the idea that you are in control of your treatment plan. You don't have to always do what the doctor says, what the nurse says, what the physio, what the chiro, what the massage therapist says. You get the ability to choose. It may be wrong, but it's your choice, right? That's what empowerment is that you're allowed to be wrong. You're allowed to be right, but you're allowed. So we can let them know that, like, especially in the case where they think that's their only option, what are the other options? Maybe go to a walk-in clinic, maybe get that second opinion, maybe see a different therapist. And you got to walk that line, obviously, of where you can't completely, just like put your thumb down on who they're seeing, unless of course you know that person's illegal and you have to tell them to go to the cops. But otherwise, right, you got to dance around it and let them know that they are the ones who have the final say. They don't have to do something that they don't feel right in, and I've had that, even, like, say, for example, and this is a commonality, and is the cervical adjustment, right? For okay. Not everybody agrees with it. Now, some people may not want to verbalize it, and they say it to me. I'm going to tell them that, you shouldn't be afraid of offending that person. You tell them that it's not comfortable and that you would like to avoid it. That is your position. And it's the same with anything. If they don't like that medication they're on, they can go back and say that to the doctor. Maybe even there, get some more information. Why is this a necessity? What is it that I need to understand about this that maybe I'm not? Because sometimes that's what it comes down to, is they maybe didn't get all the information. So go back. But in my scope, I can't tell them yes or no to take it. They, or yes or no to do something that isn't in my scope, not completely in my purview of understanding. I have to send them back to the person, first of all, who's doing the procedure, doing the prescribing, and ask them why, explain it, and see if they can be more comfortable with it. Otherwise, go for that second opinion. Refer to another profession, another therapist, in the same profession. But all in all, that if they're going to bring it to me, if they have concerns, I'm not going to ignore it. I am going to advocate for them and tell them that they question. They have the right to ask. They have the right to be involved in their own treatment plan. It doesn't matter which therapist it is, what level it is, quote unquote. They always have the right. They're the primary point in that whole treatment plan, is that the patient gets to ask questions and have say.
Yeah, and I think that's where I've seen a lot of pushback from patients, or even from the referral person. Or because I had a really rude awakening when I first moved to the Thousand Island area, because I was in Kitchener, Cambridge, Waterloo area. Then I was in Ottawa, and I had grown accustomed to collegial sharing of information and referrals. And I felt I was very comfortable sending people to psychotherapists and social workers, or to someone for orthotics, or to go back and ask the surgeon, the GP for referral to check out, get film or something on an MRI or whatnot. So I didn't think anything of it. Then I get to Thousand Islands, and I would even have doctors call me back, or receptionists or whatnot, and go, "Why are you sending your patient here? You're just a massage therapist," or certain things. And I got very quickly, I had to change from me sending a note with their written consent over and emailing it, to just giving it to the patient and coaching them to take it. I had to essentially train my patients to go advocate for themselves.
Yeah.
Because wanted the referral, but they weren't necessarily empowered to do it. And sometimes it would take 2 or 3 or 4 sessions where they would come back and see me again. It was like, how did that go with referral? Oh, I didn't tell my doctor it yet. Why not? Well, can you just write it down for me? And then I'd write it, and then they would bash me to the patient, and I would come back. They would come and see me again. They're like, they don't think that I should go and do this. It's like, okay, well, they didn't think, did they examine you? Well, no, they just looked at your note and they threw it away. Like, that's the level of disrespect that I got. That was huge for me. It was a big eye opener when I got there, because that was not what I was accustomed to in Cambridge and not what I was accustomed to in Ottawa. So cultures are very different from region to region. And that's why I think it's been so great helping, and it got me more interested in mediation, because of course I'd have patients come in and they would have all these work issues or these problems or these legal things that were happening. And I was just like, I can see that I'm helping you with your stress and maybe some of the pain associated with the tension that you have in your muscles. But you walk out of my office and then you're going right back into that jungle. And how about you just talk it out with somebody? How about you just formulate an agreement and path forward? Because I saw how sometimes therapy was, like, talk therapy was very beneficial for people. But at times they're going, and being in therapy myself, I love therapy. I'm not bashing it at all. But the look of talk therapy, the focus of talk therapy is on things like CBT, cognitive behavioral therapy, like what, working on, getting you to try little habits or review or assessment of yourself. Great. But how is that helping you in your divorce? How is that helping you figure out how to talk to your sister about whether or not you should put your mom into a home, a long-term care facility? Mm-hmm. How is that helping you navigate the fact that you're an independent contractor in a workplace and they're treating you like an employee? It's not helping you. So that's sort of what pushed me more into the legal aspect of it. Because I was like, you know what? This is not serving people. I'll send them to Chris to get relief. And then they can come to me to come and formulate an action plan.
Collaborative effort.
Yeah. Yeah. So Chris, I know we could talk about this all afternoon, and we've talked many an evening. So I think maybe we should probably end it soon. But I want to know, how, other than going to your clinic in London, how can people find you?
Oh, obviously online. I'm completely there on Facebook. My clinic, Boss Health and Wellness in London, on the Jane app to access our stuff there. Yeah, there's a few different ways. As we know, the biggest way, and I know it's not Instagram, but Facebook, it allows for greater communication back and forth on more in-depth subjects. So, and just Chris Semenuk, RMT, that's as basic as it is. I don't have any other crazy monikers or whatever. It's just my name.
You're not the massage guy on TikTok?
No.
The monsieur.
Oh, no, he's definitely not that.
No, definitely not. Absolutely not.
No.
All right. Well, I hope you would be willing to come and talk to us again. And, it's always a pleasure. You're such a delight.
Well, if you and the Reverend would like to have me back again, then yes, I would love to.
Yeah, great.
Maybe again with James, and then we can really have a crazy back and forth session that goes everywhere.
Oh yes, everywhere and anywhere. And also, audience, if you have any questions and you haven't been able to find Chris, but you would like us to pass it on, feel free to write us at toughcallmediation@gmail.com. Thank you for listening. We really appreciate your time here with us today and hope you had a chance to think about some things. And we're looking for a like, rate, and subscribe. We hope to see you next week. Bye for now.
Bye-bye. Thank you. Thank you for listening to Tough Call Mediation. This podcast is sponsored by Herb Legal LLP, editing and original music by Tyrai Laughton, marketing by Jasveer Bhatti of Herb Legal LLP, assistant marketing by Hope Ursek. Connect to our website, herblostservices.com. Follow us on Facebook, Instagram, and YouTube.